have to say it's a little hard to follow three national experts and talk about behavioral health, especially someone who's coming in relatively new to this field. But there are a few comments I do want to add at this point. One of the things that I was struck with in Sherry's talk is how our mental health coverage system really has improved pretty dramatically over the decades. And looking at it changing from one year to the next and seeing the limitations of the system, it's easy to get somewhat discouraged about the problems with the system. But when you have that longer trajectory, there's a lot to be pleased with as far as our progress in improving coverage for mental health services. Now, so coverage is a good thing, but coverage has its limits as well. And I think there's a lot that we need to do for the delivery system, which Sherry talked about a little bit, but I think particularly as coverage increases, it's time for us to increasingly focus on improving our delivery system. So just a couple of thoughts on that. I agree with Mike that we are headed towards integration of physical and behavioral health services. It's not just something that is going to happen, it's something I absolutely feel strongly that should happen. People with serious mental illness have a disproportionate burden of chronic diseases that are the leading killers today. So even if your only focus is on heart disease and cancer and diabetes, you need to be dealing with people with mental illness. People with mental illness have a disproportionate share of the risk factors for these. They have higher rates of smoking, higher rates of obesity. They're taking antipsychotics that have metabolic effects that put them at increased risk. I spend a lot of my time these days thinking about how to reduce smoking rates, and that brings us right back to people with mental health problems. And so that there's really no choice for us to integrate our systems. I agree also with Mike, though, that integrating the systems provides opportunities and it provides risks. If we do it badly, things could get worse. If we do it well, things could get a lot better than they are right now. And our agency's been working with Office of Mental Health and other agencies to try to craft a plan under Medicaid that would provide a better system for integrated physical and behavioral health services in the future here in New York. While we're thinking about a better integration between physical and behavioral health services, we also need to be thinking about better coordination within our mental health system itself. Right now, as I'm also coming in new to this field, I'm struck by how much separation there is between inpatient and outpatient providers, and between medical service providers and social service providers. This is particularly important for patients with a chronic health problem that frequently go to multiple different types of providers. They need to be working together, to me ideally integrated, if not then certainly well coordinated. And people with mental health problems in particular need social services. They need housing, they need rehabilitative services. If that's totally disconnected from their medical care system, it's just not going to work well, either for either side, for either the social service needs or their medical needs. We worked with the Office of Mental Health over the last year or so on a care monitoring initiative that really pointed out the degree of fragmentation that we have right now, where we identified patients who had various measures of high degrees of need, having received some pretty intensive services, but that appeared to be disengaged. And a large proportion of those, when we got detailed information on them, had no accountable provider at all. There was nobody who said, this is my patient, this is the person I'm trying to help. And these were the people at greatest risk. These are the ones that we would think at least those should have an accountable provider. So we need to have a much better safety net that really helps people along who are in greatest needs. I think that the health homes does provide a real opportunity to do that. It's 90% federal financing. It's supposed to be knitting together networks of providers that will be accountable for the care of people with mental health problems. Again, it's a question now of, do we implement those health homes well in New York State, or do we miss that opportunity? One of the things that is essential, but won't by itself solve the problem, in order for it to work, I think, is our better systems for health IT in the behavioral health area. And our need is, I think, a little different from what we have been dealing with on the physical health side through our primary care information project. It's not just about improving the quality of care within an individual provider, although we need to do that as well. It's developing much smoother systems to identify patients as they bounce from one provider to another. The health home needs to know if a patient was discharged from a hospital, do they show up at some outpatient provider within the next 30 days, including some outpatient provider that no one expected that patient to show up at. We don't have systems anywhere near capable of doing that, and we need to have them in order for us to really be able to help these people with these chronic and relapsing or remitting illnesses. Another point I want to make is that we at the health department we're responsible for dealing with the mental health system outside of jails. We're also responsible for providing the care with people with mental health problems who are in jails. It's a very large and growing population. It's something we spend a lot of time trying to improve, and although we all recognize it as a problem, it's still too disconnected from our Medicaid systems and our larger mental health systems in the state. When someone gets incarcerated, they lose their Medicaid coverage, even if they never are convicted, even if they're just arrested and spending a few days. And so they're, I thought you're supposed to be innocent until you're proven guilty in this country, but you may be innocent, but you lose your Medicaid coverage. And so they drop out of the Medicaid system, and most of them will drop right back in a relatively short period of time, because most people don't spend that long time in jail. So we need to have them integrated into Medicaid. We need to have them integrated into health homes, because this really is the subpopulation that is in the greatest need. Two other points, and then I'll close here. One of them is Arlene talked about our problems with substance use, and those are crucial. They're crucial not just for people with mental illness, for whom many of them are also using drugs, a very large proportion. They're crucial for people without mental illness, and they don't get enough attention. There is an opportunity in there, and that is these substances don't come from nowhere. They are, to a certain extent, marketed and promoted, some of them through legal channels. So alcohol is the drug of greatest use, and that's heavily advertised and promoted. So in theory, as a society, we have an opportunity for some primary prevention to try to reduce that promotion, to try to draw fewer people into heavy substance use and addiction. A large and growing problem in New York as well as nationally are prescription opioids. These are things which come from the medical care system. It's our own system. The enemy is us here. And we can and should do more to try to improve that system so we don't draw so many people into being addicted to those drugs. And which brings me to the issue that is closest to my heart, and that is primary prevention across the board. Certainly on the physical health side, we know it's an awful lot better to get people to quit smoking than it is to deal with the heart disease or stroke or lung cancer that they get from smoking for 20 years. On the mental health side, I would love to have a strategy like that prevents people from developing mental illness in the first place. We're not there yet, and we may not be there for a long time, but I think it's something that we need to, as a society, invest in to really better understand how, at the population level, these illnesses develop in the first place, and what we can do at the population level to reduce their incidence in the first place, so we don't have such a strain on the delivery system down the line. Again, that may feel like a pipe dream, but I do think primary prevention ultimately is where we get our greatest population health benefits, and I want to continue to remember that as we work on improving our system. Thanks very much.